My name is Antonia Goggans, and I live in Fremont County. Last spring, I took a trip to Spain to walk part of the Camino to celebrate my birthday. And as a result, I kind of overused my knee and was limping and thought I might have to cancel the rest of the trip. And we were in a small town in the southern part of Spain, Tarifa, and I was kind of hobbling along in a lot of pain. Ran into a woman, asked if there were any clinics or doctors around, and she pointed us in the direction of someone she had heard of that was very good, and said we could just walk in. And we did, expecting them to know that we were foreigners and tourists and to perhaps be set up to be taken advantage of or to have to lay out a lot of cash. We went to a sports medicine clinic, waited maybe 10 minutes. They asked us no questions about insurance. They just concentrated on what's going on. Saw a physician who did an ultrasound, I believe, of my knee and said, here's what I think's going on. He said, we don't have the equipment here to do an MRI, but I can take care of it so that when you get up off this table, you'll feel safe and secure and be able to continue. We were going to continue to Morocco, and that was going to involve lots of walking. He taped my knee and answered all my questions, had a great sense of humor. I left with really kind of a big smile. I felt a whole lot better. We asked for the charges, and it was the equivalent of like $36 US. And we were surprised, in fact. We said, you know, is that it? We're used to, you know, it's going to be an extra charge later for the ultrasound. And he said, you know, if you want, I can make up some stuff. I was able to continue on the trip and enjoy it. I followed his advice that you need to follow up with your doctor. It's hard for us to find a primary care doctor in Fremont County. So we were using the walk-in clinic, and they did an exam and said, you know, can't tell what's going on without, you know, more tests. They thought perhaps an MRI was called for, and so they sent me to a specialist. I was thinking that I was going to the specialist to get an MRI. We have to first do an exam, and since it's a specialist, you have to pay a copay of $50. They did an x-ray, and the doctor took a look at it. He wasn't really sure, and he said, yeah, maybe an MRI is called for, but we have to call your insurance and get that approved. And I thought, okay, so another appointment. But it turns out that the MRI didn't have to be approved by my insurance. But in having to come for another appointment for the MRI, there was another specialist co-payment of $50. What hit me was just the focus that here there was so much concern about how, I guess, the medical services and providers were going to get reimbursed and whether it was going to be covered by insurance or not, and making sure that I knew what my responsibility was and was willing to pay that up front and all of that, and thought, wow, in Spain they just said, you're in pain, let's take care of that, and for much less.
Here's another example of why we need universal health care. In our America, the decisions are made by those who show up. Will you show up? Please click on the like icon below. If you want to know when we release new videos, click on the subscribe button.